Good afternoon. I'd like to welcome everybody to this particular pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. As a reminder, please take the online Learning Cum Evaluation Test exercise for Mastery of Learning and have a perfect score to get the certificate as shown below. The link has already been placed in the chat box. Another reminder, 50 OLETE certificates will entitle one mentee or participants to a voucher for a ROJoson telemedical consultation. The voucher is shown here. Another request from Dr. Joson, feedback to this pep talk. Please type in your feedback in the chat box during the open forum and before we part ways. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My pep talk today is entitled Cancer Awareness and Myth on Causation. This is part of my contribution to the National Cancer Consciousness Month program of the Department of Health in February. The empowerment objective is for the lay people to have a basic understanding of what is a cancer and its associated myth in causation. Here are the contents of this particular pep talk. What is a cancer? What are the different types of cancer? What are the causes of cancer? And what are the myths and misconceptions on the causation of cancer? This will be the focus of this talk. What is a cancer? Cancer is a medical disease when some of the body cells grow uncontrollably with a potential to invade the adjacent body tissues or organs and to spread to distant tissues and organs. I will amplify these pictures. So this shows a group of normal cells. And then when cancers develop, there is a multiplication or division, multiplication of the cells with no control, and then there's a tendency to invade the surrounding tissues. And then cancer can also spread to distant organs. Example here, this is the original tumor in the colon. It has spread to the lungs. Okay. Before going further, let's clarify one associated term of cancer, malignant tumor, and differentiate it from benign tumor. So what is a malignant tumor? Malignant tumor is the same as cancer. What is a benign tumor? Benign tumor is not cancer. Malignant tumors invade and spread. Benign tumors do not invade and spread. So this is the main difference between the two. What are the different types of cancers? There are more than 200 types of cancers. The type of cancers can be categorized into whether solid or liquid based on organ or tissue of origin, and then based on the specific cell of origin. Cancer can be described as solid tumors, or another term for that, organ tumors, or liquid tumors, or blood cancers. Both types are similar, meaning the solid tumors and the liquid tumors, they're similar in that they are made up of abnormal cells that grow uncontrollably. Solid tumors form a mass or multiple masses, and the liquid tumors circulate. It goes around the body through the bloodstream. Another category in in the differentiation in the different types of cancer will be based on the organ or tissue of origin. Examples here will be cancers arising from the breast, brain, bone, stomach, esophagus, lymph nodes, epithelial tissues, connective tissues, muscular tissues, nervous tissues, and other organs. It has to be noted that no organ in the body is spared of cancers. So all body parts can develop cancers. So rare though or uncommon in the body are cancers of the heart, spleen, and appendix. These are relatively rare. Another way of categorizing the type of cancer will be based on the specific cell of origin. Example, there are different cells in the epithelium, in the skin, or the lining of the wall of the intestinal tract, epithelial, or even the skin. So you have such a particular cell coming from the gland, which is called adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, transitional cell carcinoma. What are the causes of cancer? The main cause of cancer is mutations or changes to the DNA in your cells. So basically, cancer is a genetic disease it is caused by changes to the gene that control the way our cells function, especially how they grow and how they divide. Genetic mutations can be inherited, hereditary, but only in 5 to 10% of instances. We have to remember that 5 to 10% of instances. Majority are not inherited. They occur after birth as a result of environmental forces. These external causes, which are called carcinogens, can include the following: physical carcinogens like radiation and ultraviolet rays, light; chemical carcinogens like cigarette smoke, asbestos, alcohol, air pollution, and contaminated food and drinking water; biological carcinogens like viruses, bacteria, and parasites. So let's now go to the main topic for today, misconceptions and myth. Misconceptions about cancer causation are often rooted in outdated theories. They can cause undue stress, confusion, and interfere with effective prevention and treatment. Here are some common cancer myths on causation with some evidence-based information. When I say it's a myth, it's a belief that has no strong evidences to support it. The listing of the myth that I'm going to present here come mainly from the National Cancer Institute. First myth: is cancer always genetic? If someone in my family has cancer, am I likely to get cancer too? The answer is not necessarily. Cancer is caused by harmful changes or mutations in the genes, but only about 5 to 10% of cancers are caused by harmful mutations that are inherited from a person's parents. The remaining 90 to 95% of cancers are caused by mutations that happen during a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco, smoke, and radiation. These cancers are called non-hereditary or spontaneous cancers. So the answer to this question is cancer always genetic? Not always, in only 5 to 10%. Majority, 90 to 95%, are not hereditary. If no one in my family has had cancer, does it mean that I am risk-free? I'm not at risk to develop cancer? The answer is no. Based on the most recent data, about 38% of men and women will be diagnosed with cancer at some point during their lives. Most cancers are caused by the genetic changes that occur throughout a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco, smoke, and radiation. Other factors such as what kind of food you eat, how much you eat, and whether you exercise may also influence your risk of developing cancer. Is cancer contagious? In general, no. Cancer is not a contagious disease that easily spreads from one person to another. The only situation in which cancer can spread from one person to another is in the case of organ or tissue transplantation. A person who receives an organ or tissue from a donor who had cancer in the past may be at increased risk of developing a transplanted related cancer in the future. However, in actuality, the risk is very low, extremely low, about 2 cases of cancer per 10,000 organ transplants. Usually, doctors do not use or avoid the use of organs or tissues from donors who have history of cancer. Do cell phones cause cancer? No, according to the best studies completed so far, cancer is caused by genetic mutations, and cell phones emit a type of low-frequency energy that does not cause damage to the gene. Does microwaving foods in plastic containers and wraps release harmful cancer-causing substances? No, the answer is no. Plastic containers and wraps labeled as safe for use in the microwaves do not pose a threat. Will eating sugar make my cancer worse? Will eating sugar cause cancer? No. Although research have shown that cancer cells consume more sugar or glucose than normal cells, no studies have shown that eating sugar will make your cancer worse, or that if you stop eating, your cancer will shrink or disappear. However, a high sugar level or diet may contribute to excess weight gain, obesity, and obesity associated with an increased risk of developing several types of cancer. Can artificial sweeteners cause cancer? The answer is no. Does trauma cause cancer? Does trauma to the breast cause cancer? Again, the answers are no to these two questions. Does negative thinking or attitude cause cancer? Does stress, anxiety, depression cause cancer? The answers here, no and no. Will dyeing hair cause cancer? No. Since the 1970s, most of the harmful chemicals that have been identified have been removed from hair dyes, and modern studies have found no increased risk of cancer in people who dye their hair. Do underwire bra cause breast cancer? The answer is no. This is related to the question of trauma causing cancer. No. Do antiperspirants or deodorants cause breast cancer? The answer is no. The studies have found no evidence linking the chemicals typically found in antiperspirants and deodorants, which is usually the aluminum substance, with changes in breast tissues. Do frequent ejaculation cause or prevent prostate cancer? Frequent ejaculations do not cause prostatic cancer, though some studies are showing protective effect of frequent ejaculation on prostatic cancers. When they say protective, it is tend to reduce or prevent prostate cancer. But these studies, the results of these studies have to be validated yet. Can cancer surgery or tumor biopsy cause cancer to spread in the body? The chance that surgery will cause cancer to spread to other parts of the body is extremely, extremely low. There is more benefit in doing a biopsy than not doing it, as a definitive diagnosis is needed for a proper treatment. So summary and takeaway in this particular pep talk, I have discussed the following. What is a cancer? What are the different types of cancer? What are the causes? And I have also presented the myth and misconception on the causation of cancers. Okay. Is cancer always genetic? Am I free from cancer if I don't have a family history of cancer? Is cancer contagious? Do cell phones and microwaving foods cause cancer? Will eating sugar make my cancer worse? Will eating sugar cause cancer? Can artificial sweeteners cause cancer? Does trauma cause cancer? Does trauma to the breast cause cancer? Does negative thinking or attitude, stress, anxiety, depression cause cancer? Will dyeing of the hair cause cancer? Do underwire bras cause cancer? Do antiperspirants and deodorants cause breast cancer? Do frequent ejaculations cause or prevent cancer? Can cancer surgery or tumor biopsy cause cancer to spread in the body? So these are some of the myth and misconceptions that I have discussed. If you know of other myth, you can bring it up during the open forum. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on myth in cancer causation. Knowledge is power. It gives power. Use the 4Ks for patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in preventing the myth in cancer causation in affecting health management. With this, I end my pep talk. Cancer awareness and myth on causation. I hope I have empowered you to have a basic understanding of what is a cancer and its associated myth in causation. Before we go to the question and answer portion, reminder, take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultation. Please type in your feedback in the chat box during the open forum and before we part ways. And then let's now have a group picture taking before we start the QA and interactions. So the floor is now open for open forum, comments, suggestions, sharing of experiences, etc.